#1 in the Ozarks. You're watching.
On Bridging the Great Health Divide, we're digging into the nationwide shortage of doctors. Many consider the problem a crisis in our less populated areas.
Data shows only 1% of doctors practice in these remote communities. That means getting care to 250,000 Missourians is a challenge. Ashley Reynolds traveled to an area also fighting to keep its hospitals.
In this area, we've lost 3 hospitals in the last 5 years.
Karen White is the CEO of Missouri Highlands, which has about a dozen clinics in southeast Missouri. She'll tell you they're doing their best to meet the need, but the stats are tough to hear.
Living where we do, our health outcomes are really bad. We have a lot of chronic diseases.
According to this latest assessment report, rates of heart disease, stroke, COPD, arthritis, and diabetes are higher here compared to the state.
We lose people in our community because things aren't caught.
Marcia Towner does not want to be a statistic. She's here every 3 months.
I take cholesterol medicine, and I have to get a blood check for my liver content. This place is a blessing for Van Buren.
Same for Lacey Bishop at the Eminence Clinic. She has a heart condition and is on anxiety medicine.
I think a lot of people might not seek the care that they need just because they're used to toughing it out.
Healthcare providers Zoom with patients when possible, but good internet access can be a hurdle. 37% of women 50 and older here do not get regular mammograms. Workers try to get this MU mammography van here every 2 years. Missouri Highlands recently opened a women's clinic in Poplar Bluff.
People may or may not do adequate self-care. And so by the time they come in, they're already stage 2, stage 3, stage 4.
Patients can get a colon cancer test.
And so they take the little kit home and they bring it back to us that you do every year, once a year. Pretty accurate.
Susan Norris treats hepatitis C, which can cost about $100,000. However, there's a slide fee for those who qualify. Listen to this.
I can see them for a third of that cost. If they're in the poorest category, the slide fee is $20 and the labs is $15. So their entire hepatitis C treatment costs $200 or less. Those patients would go on to have cirrhosis and die. And now they're not. I've cured over 150 people.
Bridging the great health divide, one patient at a time. For On Your Side, I'm Ashley Reynolds.
If you've missed any of our Bridging the Great Health Divide stories, you can find them in the On Your Side section of our news app.